Dan Mucci, and I'm the Mission Advancement Director for the agency. Today I'm filling in for Kyle Schwartz, and today we welcome back Dr. Robert Willoughby, who is our Care Pathway Program Manager at the agency. So Robert, it's been a little bit of time since you've been on the program. Why don't you refresh our viewers a little bit on your diverse background? You've had a few professions and maybe where you grew up and went to school.
Yeah, a few professions is right. I've been a groundskeeper. I owned my own lawn care business at one point. Professional chef, and one of the most notable things is I was a paramedic for 15 years, and that's pretty notable because that kind of drove me back to psychology, and obviously now I'm working as a therapist in psychology. Where did I come from? All over the world. I've been everywhere, lived everywhere, essentially. Lived in many different countries, but I spent a long time growing up in Monroe Falls, which isn't too far away from here. And I went to school around there and graduated from Walsh Jesuit High School.
Nice. So you mentioned some travel experience. You mentioned your careers. One of the ones that interests me probably the most is you as a paramedic. And being that you're in charge of the Care Pathway program, which deals with a lot of suicide ideation and people struggling, how did that profession actually help you as you moved back into being a therapist? Because you were probably called out to many homes that were having some of these struggles or challenges.
Yeah, definitely a lot of crisis situations as a paramedic. And one of the things that kind of prepared me for here that may be unique to my experience is you get immediately prepared for how to deal with those crisis situations, how to take some chaos that's in front of you right now and bring some calm to it, help it to reduce down and start to help somebody see that there's some solutions to their problems. That's kind of like a first line treatment and a first line basis. Although sometimes it didn't always work out. But many times it did work out, and many times it was very helpful for the patient that we were dealing with and helping and getting them onto a path of healing.
Nice. So we are heading into the holiday season a little bit. Most people look at this as a joyous time, getting together with family and friends, but we know even in the high school setting or the collegiate setting, a lot of kids are going back home. And sometimes their home life isn't so happy, or those family gatherings aren't the joyous celebration that we perceive them to be. So what are some tips we can give to probably help those parents along as kids start to return home?
Well, you have to recognize that being with family sometimes is a trigger. What's the common saying, 3 days with your family or something like that? And then everything goes to major stress levels. But the reality is holidays may be stressful times. Holidays may bring up memories of other stressful times, and that can be a trigger and put people into a funk or depression. Or people may feel lonely. Even though there's more people around, they might feel lonely, and they might not be able to recognize that the people around are there for them. And that can trigger some sadness and some negative feelings. So just being there, offering the support, recognizing that, and doing the best you can to be inclusive. Make sure you let them know you love them. Those are the major things that while they may push back on it, the reality is inside it does help.
Okay. We're also entering a time where the days are starting to get shorter. Darkness is setting in a little bit more. What should parents and caretakers be looking for during these days, especially if the child appears to be a little down or struggling a little bit?
Well, I already mentioned that piece of loneliness, right?
Right.
And loneliness is a big thing, and you might feel lonely and feel misunderstood, or like nobody can understand you because you feel so alone that you think that you're just so unique that nobody's had anything similar to your experience. But the other parts are obviously just like a persistent sadness or melancholy, mood changes, sometimes dress changes. Like so you start to wear a radically different style of clothing or something like that. These are some signs that something's going on and it's worth having a conversation about. And you want to make sure that it's okay to ask about suicidal thoughts. It's okay to ask if you're feeling down. Having these conversations and making it more comfortable to have these conversations is what promotes that mental health help in the home.
Yeah, and so picking up on that real quick, so if the days are a little bit shorter, should families try to do more activities together, maybe exercise a little bit? I know I kind of went off script here a
Oh,
little
no,
bit,
that's
but just
okay.
doing a follow-up question for you.
You know, time in nature is a really good thing. It's getting cold outside, but if you can stand a little time in nature, nature is a really recuperative thing, and it can help. And doing activities like that with a family might help. So like this time of the year, hay rides, pumpkin patches, things of that nature, and then we'll be transitioning in like it snowed today, right? So maybe we go outside and have a snowball fight or something if you can do that. But time together is great. But you have to be able to be open about that and push for it and encourage your child to be a part of things.
So let's talk a little bit about the Care Pathway program, which works predominantly with our teenagers who have a little bit of suicide ideation. You have a group called Dialectical Behavioral Therapy Group. Why don't you explain to our viewers a little bit about what DBT means and then how that works?
Our group is a DBT-informed group.
Okay.
And we call it Doing Better Together, same anagram. So, but what it is it provides skills and helps people be able to manage extreme emotions. It's really distracting, distressing emotions. One of the things is called distress tolerance. And what it does is it takes a look at what's called the dialectic. So that word is in there, dialectic. And dialectic means opposing thought. So you have two different thoughts that are sometimes extremes of each other, opposites of each other. And what you want to do is be able to work with that. So like sadness and happiness, for example. If somebody's sad or really down, you do an opposite action. And the opposite action is doing something you know that makes you happy. And it may not make you as happy as it did in the past because of your starting point, but it's something that can help draw you out.
Okay. And does your program work with other modalities to help kids who are struggling a little bit?
Well, we do individual therapy as well, and individual therapy should be supported by the DBT process, but also individual therapy has many different modalities that can help and support the client, and that might be for some people the way to go because some people aren't very comfortable with other people and social anxiety and things like that.
Yeah, so as a parent myself, there's other parent caregivers out there. These are big concerns and huge topics. So what would be a conversational starter if I thought or just believed my child could be experiencing some of this? As you said, you notice the change in dress, you notice them hanging out in their room a little bit more.
I'm a big favor of the direct method. Right? So let's be direct and open and honest. If you start to banter around, your child's already going to know that something's going on because you're out of sorts. Right. You're not doing the normal things. So being direct about it, letting them know that you care. First off, I'm here for you. I care about you. I love you. I know you may not want to hear this, and this may be ick to you, but I've had my children say to me, "Ew,"
Right.
But the reality is, be direct about it. Ask the questions. Are you depressed? Are you sad? Is there something going on that I can help you with? And I really need to know: are you suicidal? Because if you are, we need to get you some help right now.
And you mentioned the word suicidal. So many people think if you bring up that word, you're planting the idea to your child or to somebody else that you care about, but that's actually not true. Is that correct?
That's correct, and I've actually had that conversation with my mom a few times because that's an old kind of adage that goes around. And the reality is research doesn't support that. Research supports that talking about it and being direct and upfront about it is the way to go with it. You're not planting something in their head. If they're there, they're probably already there,
right?
Or they're going to find their way there.
Okay, so we've identified the problem. We brought the child to the Care Pathway program. You guys have worked through the struggles. The child is ready to transition back to home or a more normal situation. How do you guys work with that transitional period?
Well, if we did our jobs well, along the way we should have built a lot of skills that help with that. You can never take somebody to 100% and then dump them out. The reality is you have to give them the skills that they can keep working on themselves to help them. So you're doing that along the way. And if we're getting closer to a transitional period of where they're going home and they're or being discharged from our outpatient program, you have the talks with them and you say, how are you going to handle this situation? How can we handle this? So we can set up some situations and role play and do some things to help them to integrate back into school, friend groups, things like that. And encourage them that, you don't have to talk about this with your friends if you don't want to, right? You have the right to say no. You have the right for your boundaries, and that's okay.
And if somebody is struggling, what are some key numbers they can remember to reach out to?
As far as numbers, there's 988. That's the newest number. It's a national hotline, and the really cool thing about it is they're going to help get you to local resources. So if you call 988, they're going to talk to you right now, and they're going to help you with whatever's going on, but then they're going to help you also access other aspects of healthcare, get you into a program, or support the program that you're already in and identify that with you. Other numbers are obviously 911. That's never a failure to call that, and if it's imminent or you've done something, 911 is the number to call so that you can get the appropriate care, and usually you'll get a mixture of police, medical, and fire, or some mixture thereof. In our area, another national number is 741-741, which is a texting line, and you can text for that if you don't feel like talking, and that can really help us. There's also 800-273-TALK, and that number is another national hotline, but it's mostly trying to shift people towards 988 right now. And then in our area, in Stark County, we have Coleman Crisis, which you can call at 330-452-6000, and that number, again, hooks you up and it links you to other people who can help you, helps them to assess the situation right now and see if maybe hospitalization is needed, or can we get you home and then check on you after.
One of the other things about 988 too is you can text. So for a teenager who doesn't want to pick up the phone or call, and so many of them on their devices like to text, it's another important way to reach out and feel maybe a little bit less anonymous.
Well, yeah, there's that part too, and then there's this part of control. You're able to control that with having the phone in your hand, helping to guide that conversation. You're in control, be able to give what information you want to give. So that's a really cool thing about that.
Yeah, and is there anything else you want to add about your program that you don't think we covered or that you think people really need to know about?
You've probably seen the memes on Facebook or whatever social media you use is, don't be afraid to offer other people a kind word. We really don't know what other people are going through. And you may walk up on somebody and they seem like they're in the worst mood ever, but you don't know why. And a kind word can really help, a smile even. Another thing I want to make sure that we point out is, we have to be really sensitive to culture, especially when it comes to matters related to suicide. And the LGBTQ plus community is a much higher rate of suicide attempts and suicidal ideations, and we want to make sure that they're included in the conversations, and that they're included in life and being able to participate, and those communities benefit from that.
Well, we thank Robert for being on our show today, Dr. Willoughby. If you have any questions or concerns, Dr. Willoughby is available at our Belden office, 330-433 6075. I went blank there for a minute. I apologize. You can also look at our website, www.childandadolescent.org. I thank you for joining us today on Q&A. I enjoyed guest hosting, and Kyle Schwartz will be back with you for our next segment.